This is an information video from the Rhodesian Ridgeback Club of Great Britain. It's aimed at assisting breeders and the veterinary profession in recognizing and understanding some of the problems associated with dermoid sinus.
Right in the centre of the picture you can see a dimple in the middle of this dog's back, right at the base of his tail, here. This dimple, if you look closely, you can see there's a little sinus in the middle of it. And a true dermoid sinus, when you pull the skin, it's attached, it folds inwards, it doesn't come with the rest of the skin. This is because it's attached deep down to deeper structures. In fact, in most cases it's communicated directly with the dura-mater.
The breed was standardized in 1922, with the first Rhodesian Ridgebacks being imported into Great Britain in 1928. In 1932, the condition initially referred to as a cyst was first described. Any dog with this condition is born with it. It won't disappear, and it may merely be undetected. It is generally accepted that the defect arises when there is incomplete separation between the skin and the spinal cord, when the skin and the central nervous system are developing. Thus, the dermoid sinus occurs in the dorsal midline, and it's very rare for a sinus to occur actually within the area of the ridge, although it may appear from the anterior part next to the tail. A sinus at the tail head is quite common, and it may be difficult to raise the skin and palpate the thread. There may be several sinuses in one puppy. The sinus takes the form of a tube opening at the skin surface and running at varying depths toward the spine. The lining grows hair and has sebaceous glands. Dark hair may project through the external opening. There are 4 types of sinus. The first extends to the supraspinous ligament, to which it's attached. The second doesn't reach the ligament, but it is attached to it by a thread. The third extends only through the subcutaneous tissue as far as the muscle. The fourth reaches the spine, where it's attached to the dura-mater. Puppies should be closely examined soon after birth, and any affected puppy humanely destroyed. Pups should be checked and rechecked again and again, preferably by at least 2 people who've seen the condition previously. Checking for dermoid sinus is carried out by gently raising the skin immediately behind the head and passing the fold between the forefinger and the thumb slowly down the length of the back. The sinus can be felt as a fine thread. Care has to be taken to differentiate between a sinus and fine muscle strands, which may be felt especially in the neck and shoulder region. If there is doubt, raise the skin in front of and behind the suspect area, and the sinus will appear as a depressed area. If the site is clipped or shaved, a small dark hole is visible, and using a lens, it may be possible to see hairs protruding from it. The sinus can be detected by raising the skin in the midline with one hand and palpating with the other hand, allowing the tissues to slip back and forth between the thumb and forefinger. Imagine you're feeling along the length of a folded cloth, and a piece of cord is linking the middle section. You can't see it, but your fingers do detect its presence. At the base of the tail, it's very difficult to raise the skin, as it can be tightly stretched in this area. Care must be taken to check the area, feeling the surface for any dimpling, and pushing the skin in different directions with the tip of the forefinger to locate any resistance or connected tissue. If there is doubt, diagnosis can be confirmed by clipping and shaving the skin, when the external opening of the sinus can be seen as a tuft of hair projecting from it. As the sinus tube is composed of surface skin, it's the same structure, having hair follicles, sweat glands and so on, and waste products from the skin such as dandruff, skin cells, oil, dead hair, etc. can shed into the sinus. This results in the formation of abscesses in the base of the tube. The exact mode of inheritance of dermoid sinus isn't known, and it's thought to be a complex gene, as unaffected parents can produce affected offspring. The policy of never breeding from sinus-affected animals is extremely sound, and indeed most clubs would advise against it. Surgical correction is only occasionally successful, however culling at an early stage is a more humane way of handling the problem. In the 1960s in the United Kingdom, the incidence of dermoid sinus in the breed was around 10%. This figure has fallen to about 3.5%. That's through careful selection of breeding stock and improved detection. Doubts still remain about total elimination. It may be possible to reduce the incidence even further in future with continued care. The incidence of the condition is not solely restricted to Rhodesian Ridgebacks. Cases have been recorded in boxers and Shih Tzus. Ridgelessness does not offer any protection from the condition, and it can occur in crossbreeds. In its code of ethics, the Rhodesian Ridgeback Club of Great Britain includes a section covering dermoid sinus. It says all puppies should be examined for dermoid sinus a few days from birth and checked again at least twice before leaving for new homes. Any pup with the condition should be humanely destroyed. When a sinus is found after the puppy has been sold, the code gives breeders two clear courses of action. The breeder can agree a financial contribution towards an operation to remove the sinus and neuter the puppy, or take the pup back, either reimbursing the owner or agreeing in writing to supply another puppy. The Code of Ethics stresses that all new owners should be made aware of the facts about dermoid sinus and how to detect its presence. They should also be made aware of the implications for the breed.
With this diagram of the dermoid sinus, I'll try and explain exactly what happens in the fully formed animal. On the surface of the skin, we have hair growing. The hair folds into the dermoid sinus. The hair continues to grow, causing pressure, sometimes pressure necrosis along the walls here. And also this skin will be producing oil and sweat, and possibly, if there's pressure necrosis, also pus. Any of these products can end up in this cavity here, surrounding the spinal cord, and cause infection and compression to the spinal cord. It's contained within this tough membrane called the dura mater, which has no stretch in it. So any increase in pressure in here, there's only one way it can go, and that's to crush the cord, causing painful paralysis, and possibly even death. There's no way for it, anywhere else for it to go, because this bone surrounding it from the vertebrae is completely rigid. Very often they will discharge upwards and pus will come out onto the surface of the skin. But in individuals where the sinus is this far developed, then I would recommend euthanasia. Sometimes the sinus only comes down to this sort of level, or even as far as the surface of the vertebrae, it doesn't pass through the vertebrae. These are operable, but these animals are carrying a gene which will be passed on to subsequent individuals. So I strongly recommend that affected pups are either destroyed at birth, or if they are intended to be operated on, then it must be a condition of sale that these pups, not only if they're going to be operated on their dermoid sinus, must also be neutered to prevent them from breeding. In South Africa, they've reduced the incidence of this condition dramatically over the last 30 years by such a breeding program, where affected animals are not bred from. We don't want puppies to have to suffer the injury, the agony and the pain of this condition. So please listen to what I've got to say.
This has been an information video from the Rhodesian Ridgeback Club of Great Britain.